Good afternoon, everyone. We will start in about 3 minutes. Thank you for your patience.
Good evening, everyone. Are you hearing me?
Yes, we are.
Okay. All
All
right.
right, take a breath. Take a breath.
Sorry about that. The traffic was very thick. All right. So we customarily give persons approximately 10 minutes or so to join. And thank you for joining the program for those who are on now. We have not yet established a quorum. Dr. Ong?
Yes, we have, Alicia, we have over 12 or 13 persons there in account.
Oh, yes, at
And
the
there's,
regional office.
yes,
Okay, so it is.
so
What
we are
time is it now?
projecting downstairs. Yeah.
Okay. Okay, so it's 18 minutes past 6 o'clock. Alma, do you want us to go ahead and start, or do you want to allow a couple
Yes,
more
go
minutes?
ahead and start. Remember, we are here and it's we have curfew to meet.
Okay.
So go ahead.
Okay. All right. We'll go ahead. Good evening again, everyone. Thank you for joining another informational session of our Meditation Mondays, aired every Monday at 6 p.m. on this platform and on Zoom. Dr. Ong, thank you very much for accepting the call to join us and to share with our audience on the matter of COVID-19. It is such a very relevant topic at this time with everything that we see happening in the news, with everything that is going on, with the increase in numbers that we keep hearing. We sometimes, we are weary of what is going on. So we really appreciate you coming and speaking with us today and to just inform us of what are some of the ways that we can keep safe? What should we expect going forward? And a lot more. We really love to hear from you as someone who is in the front line. As persons may know, Dr. Ong is the regional epidemiologist, and so he's very adept in to this topic and in speaking to us. So without further ado, I will turn over to Dr. Ong if he's ready.
Thank you so much, Madam Chair. I am ready. Are you?
Okay, great. Yes, whenever you are.
All right, excellent. So thank you so much again, and good evening, everyone who are on the platform and who are also watching from the downstairs, the the regional office. I consider this group as a family, so I will not hesitate anything for this family, whether or not it is the presentation or it is the information that I have to be sharing, or even as a medical doctor, if I have to offer my medical service, I would not hesitate. But nevertheless, thank you so much for inviting me for this forum. It is very timely, and I was about to do that. And when you invited me, I just say, okay, yes, let's do that. So this topic, today's topic is COVID-19. Is it the new normal? I'm trying to put into perspective as to what's happening and what is your expectations and what can you anticipate what's going to happen in the future. Going to start and I can move my, okay, right? So COVID has been talk of the town and everywhere, even the global, any sector of the communities, private sector, public sectors, professional groups, Medical Association of Jamaica. Last night I was participating in a group, and everywhere you look, COVID is center of the conversation. And let's look at the why we are talking about this COVID. This picture trying to show to you about the economic impact locally. So we, as a Jamaican surviving in this country, and we need to look at what's happening in our country as in terms of the employment. So in the Western Jamaica, based on the published data, 4 out of 10 in Western Jamaica are employed directly or indirectly tourism. And as we all know, the tourism belt in Western Jamaica, most of us, our neighbor, our friends are one way or another directly or indirectly employed to tourism. 50% of our income as a country comes from tourism, and 50% come from remittance. So we have Jamaicans overseas working for the country, working for their family, and sending back money and remittance. So 50-50, tourism and remittance. So based on the outbreak that we have started to see beginning of 2020 March, and the shutdown of the tourism and reduced commercial and industrial activity could send unemployment to 12% from 7.3 to 12% from 7.3 in January. That is 2019. That's a prediction of central bank, and we are now in 2021, and we can see what's happening. The island central bank also projects that the economy will contract by about 5% this year. That's going to be 2020, and following 0.9% growth in 2019. And we have noted what's happening, in terms of spending, in terms of our own pocket, our own money in the bank. It is something that it's becoming impacting in daily's life. So that's the economic impact of the COVID that we can see as a bigger picture. All right, so it's also changed our way of living. It is first time in the history that business places places can be shut down for not following infection prevention and control procedure or practices, especially respiratory related. So that's not happening. That has not happened in the past, but since COVID came, as a health department, as a public health agency, we can close down the business places. And you as an individual can be arrested for not wearing masks in the public places, and we have seen that in our news and medias, and so some persons are being prosecuted for that. Gathering in the workshop places, having a party, and mourning in the loved ones become illegal. We have never heard of it, and this has become norm. We are started to afraid to shake hands. I did not remember I have shake hands with one of my colleagues or anybody who I see since March 2021. We are mindful about the infection can be spread in that way. And also in the first time in the history that our politicians are now telling us to wash our hands and wash surfaces. It's not something the politicians are not supposed to be telling us. It is the health authorities who are going to be telling us what to do as part of the public health intervention. But now we are hearing from the politicians. Politicians will say some other things, but not necessarily telling us to wash our hands. But this is the first time that we have noticed that. And also, you are going to be locked down in your own homes and not allowed to visit your loved ones in another community. So that has been the experience since the COVID-19. So if I'm allowed to pose the question, I would like to pose the questions. How many of us in this room have seen or knew or heard about any celebrities in this country, or even outside the country, or politicians, or any public figures, any of our neighbors, our friends, our co-workers, people who work with us in the department, or far or close relatives having contracted with COVID-19 since the beginning of the outbreak, or in the last 1 or 2 weeks? And I'm sure the answer is a lot. We have seen, most of us have seen or heard or even know that any one of the persons who are coming down with the COVID-19 are close relatives or anybody who we know. So this is how COVID-19 has widespread in the community. So this afternoon, I'm going to be talking about my objective is twofold. One is I just want to show you where we are at in terms of the cases. And I just want to emphasize on the preventative measures. What are the things that we can do? What are the things that we should not be doing? Okay. Now, just to be clear about, and all of us should be on the same page, I just want to emphasize that COVID-19 is the name of the disease, and SARS-CoV-2 is the name of the virus that causes COVID-19. And it is a communicable disease. And I would like to emphasize it is a communicable disease. Why I said this, we have in Jamaica, in terms of the history of the communicable diseases, our last case of polio was identified in 1982. The last case of locally transmitted measles was identified in 1991. Diphtheria in 1995, rubella or German measles in 2000, and the last case of newborn tetanus was identified in 2001. So these diseases, even though that those diseases rampage in other countries, even the developed countries, but in countries like Jamaica, we are not seeing those things these days. And some of us were not even born, those diseases were eliminated from the country. So we are doing very well when it comes to communicable diseases, mainly due to the credit goes to expanded program on immunization, otherwise called EPI program, that was established in September of 1977. So the point I'm trying to make is immunization. We talk about COVID vaccine and so on. Immunization is not something new. Immunization is with us, and we've been vaccinated since the beginning of our life. Those vaccines are, and we are now living freely and healthily post-COVID, post-vaccine era with free from those diseases. So for instance, measles, very rampage in the Europe and other countries, very contagious and transmit from one person to another, and it can impact heavily on the economy as well. But we don't have that due to vaccine. So as yesterday, globally for COVID, we have a total of 207 million, a little over 207 million confirmed cases identified globally. So if we are to compare that number with which countries, we can compare, it's like the whole Brazil or Mexico, those countries have approximately 200, a little over 200 population. So we are talking about the whole country's Brazil. We are talking about 200 times what population that we have in this country. And of those 207, we have almost 4 million, 5 million deaths reported globally. So 5 million is 2 times or 3 times population size of Jamaica. So that's how the number is so huge when you look at in the global picture. So we are looking at our own country here. So there are 2 maps on the top. We are talking about total cases identified up to yesterday. This is a report from Ministry of Health and Wellness. So these are the numbers that you are seeing. Of course, you are looking at the numbers, a lot of, let's say, for St. Catherine and KSA, so where you can see many cases are identified due to the population size. So when you look at the Western Jamaica, we have 5,693 in St. James due to the population size. So one of the parishes in the Western region included in that tally, being the top 3. In terms of active cases as in those persons who were diagnosed in the last 2 weeks, that's what we call active cases. They are active because they can transmit the virus to other persons, and they are also actively suffering from COVID-19 disease. When we look at the numbers, again, Kingston and St. Andrew and St. Catherine, you see based on the population size, you have many cases. And when we look at our parishes in the West, we have 2 parishes, St. James and Westmoreland, included in the top 5. Now, looking at the rate so that we can compare between parishes. So this is the rate of both total cases and active cases. And the darker areas are where parishes are where most increased rates compared to other parishes. So one more time, St. Catherine, Kingston, and St. Andrew, the highest, followed by St. James. St. James is one of the parishes in the Western region when it comes to total cases rate, that is rate 100,000 per population. For active cases, we have two parishes in the West, St. James and Westmoreland. So the point is, when we look at the country situation, our region, Western region, is on the map, and two parishes, mainly St. James and Westmoreland, are on the spot. So for Western region, on the top, we have up to yesterday, we have a total of 11,623 cases identified as COVID positive cases, and that's a 20%, 20% of the total positives in this country. 20% contributed by the Western region. We have 1,228. That's a 10% of the total positives are now considered active. So we have 1,200 walking or staying or admitting to the patient hospitals as patients. They are active. Total number of recover, 84% of the total positive reported already recover. So 8 out of 10 patients identified as COVID-19 have already recovered. We have 517 reported as deaths. That's 5% of the total reported. This number may go down because this number is just a total number of deaths reported by the institution and parishes. So when they reach to the number reaches to the national level look at it with the expert panel, looked at it and whether or not those deaths are directly relating to COVID-19. Some people going to the hospitals with other conditions and they happen to be tested positive for COVID-19, but they are going there for other reasons and die. In that case, those persons will not be counted as COVID-19 deaths. Also looking at the different segment of the population. So we look at different groups, and this is just to show you everybody is being affected by COVID-19. So of those positives, national, 94% contributed by the national. We have 17%, that's children and teen. Children and teen as to the small baby all the way up to 19 years old. So those 70% of the positives are coming from that group because they have a higher number of population size. Compared to the rest, we have 6% contributed by the non-national visitors and 6% are healthcare workers. So this is one of the areas that I want to pay attention to as well. 6% contributed to the positives from healthcare workers. Healthcare workers as in doctor, nurses, including ourselves, administrator, even in the Western Regional Health Authority administrative staffs, some of them are included in that tally. So everybody is affected. Now, being an epidemiologist, I want to show you the graph, So this graph, I'm going to try my best to make sure that you understand this. This is the number of positives that we have identified from the lab. So people are tested for many reasons. They are coming to the hospitals, they are coming to the health centers for their illnesses, COVID-related or non-COVID related. We go into the community and testing for those communities with high risk transmission rate that are identified by the national level, and from there we receive the results. So results are cutoff point is within 24 hours. So this is the 24 hours result received the day before yesterday. So the day before yesterday, we have a total of 233 positives, 234 positives. And when you look on your right, you can see the distribution of sex. 99 of them are male and 170 are female. So female predominantly showing the positive in terms of COVID-19 in this figure. And you can see the parish breakdown. I'm not going to go into that, but you can see the number positive in Westmoreland is 174 and higher than other parishes. St. James is 71. Now looking at the graph at the bottom, this is to show the age distribution of positives. What you can 29, 30 to 39 age groups, that's for the 24-hour positives. I'm not giving you the whole detail of it, but based on the positive we have identified the day before yesterday. So the age groups those are productive age group, and they are very active in the society, and those are the one identified as active. And most percent positive, most persons are Dr. Marcia Johnson Campbell, you may want to turn off your camera. And those persons are the active and contributing in the society. All right, I was distracted a little bit. I hope you can understand the graph. All right. At the beginning of the pandemic, from the scientific society, we look at the number, what we call reproductive number, or we also call RO. It is anticipated that it is predicted that we have one infectious patient or one person who is infected with COVID-19 can infect other 3%. So RO is at the time 3. But today, as we speak, our RO is 1 point something. So it's a little over 1%. So one infected person can infect 2 persons at this point in time in this country. So let's put it that way. So one infected person can infect 2 persons. But in this figure, when we look, so one infected person can infect 3 persons within 7 days, because that's where one person starts to have signs and symptoms of COVID. And within 7 days, that person is considered infectious. So that's the time that that person can infect to other 3 persons. And that 3 persons can infect another 9 persons in another 7 days. That 9 persons can infect another 27 persons in another 7 days. That 27 persons can infect 81 persons in another 7 days. So we're looking at one infected person can infect 81 persons within a month. That is without, at the bottom I noted, without restrictions or not following the infection prevention and control. So what we are seeing today is one person can infect a little over 1%. So let's say 2 persons. If that's the case, if we have identified 1 person, there are many persons out there already being infected. So right now we have a total of a little over 1,000 active cases. So you can do the math, and if we are lacking in terms of, excuse me, infection control practices, and that's why we are seeing the explosive number of cases are now being identified as positive. What are the driving forces? While we balancing life and livelihoods, there are many factors that is driving this pandemic as we speak. Social, we are tired of being inside being locked up in our homes, and we are not allowed to socialize with our friends and so on and so forth, not allowed to go to parties and so on. So people is trying to get out of it, and that is also one of the driving forces. And economic, some people cannot stay home because if they don't move, they don't eat. They don't have any food. They cannot put any food on the table, even though they may have some sort of illness. They feel as if they have COVID, but they have to come out, that they are coming out. And that's also another driving force. And attitudes and practices, despite all of this Disaster Risk Management Act and prosecutions and so on, we continue to see parties, we continue to see people continue to breach the disaster risk management. And we also see some of our own colleagues are not necessarily practicing infection prevention and control practices. They may stick to the infection prevention and control practices on their workplace, but on the road or when they reach home or when they reach to other location, that's something that we have observed among our healthcare providers. And that's something that we have to look at. In terms of the transmission, so this is what we call change of transmissions. From one person to another person, how that infection transmits. And based on the investigation that we have for confirmed cases, we identify as local transmission with no epidemiology link. In other words, if you have identified a positive patient, when you look for the source, so we go back to what we call contact tracing. So we're going to ask, where were you in the last 2 weeks and who you are come in contact with? Do you have any ill persons at home, etc. However, the persons cannot say exactly what happened. So I did not go anywhere. I did not even go to the parties. I am not in the hospitals, etc. So we were not able to identify the source of infection. That's what we call local transmission with no link, no epidemiologic link. So that is worrisome. And also when we identify contacts, and those contacts are already being positive. So when you have someone at home infected, and when we do the contact tracing, how many persons you have at home? About 5, or almost 5 persons, those persons are already infected. So this is that goes to show that at home and generally speaking, infection prevention and control, mask wearing, hand sanitizing or hand washing, frequent hand washing, and social distancing or physical distancing are not being practiced. So those are the driving forces that we are seeing why we are seeing what we are seeing. Now, another graph that I would just want to show you briefly. So we are now talking about third wave. So this is the figure on top. Bar chart is indicating how many cases we have identified. This is for the Western region, 4 parishes. How many cases we have identified per month, each month. And we have a line graph, how many deaths notified or reported each month. So starting from March 2020, and we have noted first wave in early September and in the month of October. So that's where first wave came, and you can see the number of positive. So 711 positive, that's highest in first wave. Now second wave came on March 2021, and you can see the number of cases, 2,585 for the whole month reported, and also deaths increases, number of death reported increases. And when we are now looking at August, what we call third wave, and we already identified in 15 days of the month. We have not even reached finished month as yet. 15 days into the 30 days, we have already identified 1,242, 1242, and you can see the number is higher than April, May, June, and July. So that if we are to continue with this, and we know it's going to be explosive, and we are anticipating that the number is going to be higher than second wave. Now, looking at the table at the bottom, there are many numbers, but just try to follow the numbers shaded by yellow. The top row is showing the cases per month. How many cases? Just like up there, 711 in October, and so on. So when we look at the daily average for each month, in first wave, we have 23 positive each month, in that month, in highest in the first wave. In second wave, we noted 84, let's say 84 cases per month. That's highest in March. Now we have not even finished the whole month as yet, but daily average for August is 83. You see the 83, and we anticipate that it's going to continue to increase. For deaths, we now have a total of 36 deaths reported, and even though not as high as previous wave, which is very good, but when we look at the daily average, is 2.4, is just like second wave, and it's even higher than first wave. So that point is, when we are talking about third wave, this is how we predicted third wave is coming, and it is anticipated that we're going to see more than what we saw in second wave. So individual parish, quickly though, we look at morbidity and mortality, morbidity as in cases, mortality as in deaths. So just wanted to show you the sex and age breakdown. So for Hanover on the top, side by side, left side is morbidity and right side is a mortality. So when we look at the sex distribution, female predominantly showing a positive, more positive than male, and positive for in terms of morbidity, you see 20 to 29 age group. And when you look at the mortality, we are seeing the 60 and over, 70 and over, 80 and over are showing more deaths in that parish. When we look at the St. James, similar trend is observed, and again, female predominant, except in deaths in St. James, more men are dying from COVID-19 than female counterparts. Let's look at the Trelawney, similar trend we are seeing, a similar trend we are seeing for the sex distribution as well. For Westmoreland, we see female again, and what we are seeing in all 4 parishes is, generally speaking, more female are identified as positive, or they are being infected, but in terms of dying, men are dying more than their female counterpart. So one of the things that I just want to highlight in this wave is, people may not necessarily feeling the branch of what's happening, but I just want to paint a picture of what's happening in our health facility. We all are healthy at this point. At one point, we are going to be sick. When we are sick, either we have chosen to go to private doctors, we have chosen to go to public hospitals or private hospital, whatever it is. We may end up going to the public hospitals because that's where all the physicians, all the specialties, all the equipments are located compared to private and other locations. So when we look at the bed occupancy as in how many beds available, how many beds are filled or occupied. Okay, so please follow me closely. This is very serious. For corner regional hospitals, as said yesterday, we have a total of general bed occupancy, general beds without COVID, general beds as in internal medicine, general surgery, pediatrics, and other specialties. Occupancy rate is 81%. So 8 out of 10 beds in other services. So if you have a headache or you have a little high blood pressure, if you want to go and visit the corner region hospitals, and if you are unfortunately to be admitted to the ward, you end up not getting the bed. Perhaps that is what it's saying. 81% occupied. For COVID beds now, we have total of 59 COVID beds there. Yesterday, we have 88 patients, COVID patients in the hospitals. So you can see the total bed occupancy is 149. So there's no COVID bed available. If you happen to be COVID positive and sick and shortness of breath and you are gasping for air and all of that, you're likely to end up in the hospitals. But guess what? There's no beds. For grand total occupancy generally, both general and COVID beds occupied is 91%, so almost full. Let's look at the Savalama Public General Hospitals. Again, similar pattern. So general bed occupancy is 124. That's even worse. We have internal medicine, pressure sugar patients, surgery for cuts, and also accident and injuries and so on. Pediatric children ward, and those beds are full. Yesterday, 124%, over 100% capacity. And for COVID now, look at COVID occupancy. We have 40 beds for COVID, just dedicated for COVID patients, nobody else. For admission, if we have COVID patients, those beds are going to be for COVID patients. Yesterday, they have a total of 69 patients. So that's 40 out of 69, that's 173% bed occupancy. I mean, I don't even know how to describe this one. So there's no beds. We even need beds. You can imagine how patients are going to be housed at that point in time. For grand total for occupancy, 136. So Savalama Public General Hospital, there's no vacancy. I will go to 2 hospitals, similar pattern that we are seeing. So Noe Home Hospital, you can see COVID bed occupancy is 153. So the point is, right now, if you yourself or your relatives or your neighbor, someone you know visiting from abroad, if they happen to be sick and if they go to these hospitals, it's likely that they're going to be waiting for a long time to be seen by the doctor. And even though they need to be admitted to the ward for very sick, and most likely that they're not going to get bed. So that's what we're talking about, impact of the third wave compared to previous waves. Can we contain COVID-19? Of course, we can contain COVID-19. These are the scientifically proven and tested, and we know that they are working. There are top 10, and starting from gathering restriction, curfew, special geographic restriction, border closure, physical distancing, public transportation measure, elder shielding, work from home, barber salon closure, general work hour restriction, school restriction. You may, everything has been tested and everything has been implemented at one point and another. And we have seen drastic reduction and working properly, very effectively using this non-pharmaceutical intervention. But we have to pay the price for doing such, and there is going to be a limitation in some economic activities and some other activities that's also going to impact your livelihood. So from time to time, these restrictions and these interventions are being relaxed, and move from one place to another, etc. But I just want to show you, I want to show to you that there are non-pharmaceutical intervention that we can do as an individual. Elder shielding. If you have an elderly person at home, make sure that they don't go out to the locations where they're not supposed to be, and make sure that they are also following infection prevention and control, because they are not going anywhere at all. So most likely that you can infect that individual. Work from home, that's something that HR needs to look at. We have looked at previously, and based on our experience, we have, as a technical officers, moved from the location to others for no reason, because we have money to pay, but we have to move due to the proximity to each other that may facilitate the transmission of COVID-19. Physical distancing, very important. I noted when I visited Western Regional Office the other day, I did not see persons practicing some, the minority of the persons are not practicing that. And please make sure that these are being adhered to. And also, when you are in the public transportation, other persons may not necessarily follow, but you need to make sure that you follow the proper physical distancing and IPC measure. And also, one of the very effective, and I started by saying vaccination, the program that we have established. So vaccine is not something new. So we have this time around, vaccine in COVID fight is one of the high point and one of the hopes or highest hope that we have for this pandemic. And you can see the published paper, figure from the Ministry of Health and Wellness. That was a little bit old, but it is still relevant. And I showed to you that the total population up there, 94% of the population has not taken the vaccine as yet. Vaccine is not going to prevent you from getting COVID-19, but vaccine is going to stop you from going to hospitals with serious illness. So in other words, even though you catch the virus, you may have other comorbid conditions, but you're not likely to end up in the hospitals for waiting to be admitted there. So you're going to have some, symptoms and will go away. So that is scientifically proven, and even in the clinical trials that we are seeing across the globe. And in fact, globally, this vaccine, COVID vaccines, were introduced and inoculated, and we see scientifically in countries which has vaccine coverage, higher vaccine coverage, has less admission to the hospitals. But in some quarters, in some countries, there are relaxation in terms of, hey, our country has a higher vaccination coverage, so we stop using masks, we start using social distancing and so on. So now they are paying the price. So vaccine alone is not going to work. Vaccine combination with the IPC measure is the way to go to prevent COVID-19 from killing us. Now, when we talk about vaccine, this is the current situation that I just want you to show you. And this is part of my report to the regional level and national level. So we looked at the, on your right, the figure, the graph, show you the age distribution of severely and critically ill patients. So when you have COVID patient, there are different classification that we have. So number one, asymptomatic. So the person have COVID infection proven by the lab test, but the person doesn't have any sign of symptoms, not showing any signs and symptoms. So that's asymptomatic. Now from asymptomatic is going higher, mildly ill, moderately ill, severely ill, and critically ill. So severely ill and critically ill are as described as in severely and critical. So they are very ill, very sick. And when we look at those severely and critically ill patients admitted to Savalama Public General Hospital yesterday, I just want you to pay attention to the age group 50 to 59. Those are, we have not heard in the beginning of the outbreak, 50 and 59-year-old are relatively safe. 80 and 89, 70 to 79. As you get older, your chances of dying have increased. But this third wave, this is something new that we have seen. And even when you look at younger age group, 20 to 29, we have 27-year-old with severely ill admitted to the hospitals. We have three patients in 30 to 39 years age group, 40 to 49, 3 persons. So when you look on your left, let's look at the vaccination status of those admitted who is severely ill. We have a total of 47 seriously ill, 9 of them are critical, 38 severe, and you can see the distribution, female higher than male, female 26 and male 21. You may also recall that total positives identified by the lab, female are predominantly higher than male group in terms of number of positives. So of those 47, all 47 and vaccinated, all 47 and vaccinated. This is the evidence. So when we look at the total cases, we are talking about mild, moderate, severe, asymptomatic, critically ill. We have a total of 65 admitted yesterday. Of 65, one more time, female are more than male counterpart, and all 65 and vaccinated. So based on what we are seeing globally and other countries, this is an unvaccinated pandemic. Persons are ended up in the hospitals and dying and dead. Most person and the most person, when we look at this figure, almost all persons are unvaccinated. So this is the statement that people make. If you have not vaccinated, and you may end up getting seriously ill from COVID infection. So let's look at another hospital. This should be a Falmouth Public General Hospital. I need to change the dot. For Falmouth hospitals, we have a total of 4 patients there yesterday, and you can see the age breakdown: 20 to 29, 40 to 49. Each age group has 1 individual admitted there. All 4, 3 are unvaccinated, and 1 is the vaccination status is not yet known. For total patients, 29 patients. Again, female are more predominantly features in this group, in this case, and of 39, 22 unvaccinated. 22 unvaccinated. So it is safe to say that most persons ended up in the hospital with serious illness have now vaccinated for whatever reasons. So I'm going to wrap my presentation, but I just want to highlight a few things here before we close. Vaccine hesitancy is very much topic that we have been discussing today, and not today, I mean like currently. And you know, last week, a week before, I have requested the vaccination status of persons who work in the administrative block, and we have a total of a little over 100 persons listed as officers working in that department. I have received so far 36 responded, 36% responded. So other persons, I don't know why, whatever reasons, they have not responded as yet. Of 36, 50%, half of them are fully vaccinated, fully as in 2 doses of AstraZeneca, which we have available in the bus. And other 50% have not yet decided whether or not they're going to take it. So vaccine hesitancy is not outside in the population. It is within our own family. Now, there are many theories, many findings, and we have even found we did the study, national level did the study, and we have identified why people do not take vaccine. But I just want to summarize in 5 C's, which was prescribed in the one of the published papers. Confidence is one of the factors why people do not take vaccine. The person's trust in the vaccine efficacy and safety. That's 1. Person's trust in the health services offering to them. That's number 2. And the person's trust in the policy makers deciding on their rollout or their health. So vaccine efficacy and safety, I'm here, doctors are here, and other providers are here. If you are in doubt, we can go into detail as to what happened and publish paper and what's happening with the local situation and so on. We can go into detail about efficacy and safety. As a doctor, we are looking at efficacy and safety is relatively high, very high in this pandemic for some from the data that we are seeing. That's 1. We can address this very easily for health services offering them. So that's where I'm very worried. You know, we are a part of the system as a doctor, as a health, as an administrator, human resource manager, and so on. I'm not calling Miss Heaven's name, but I'm just using it as an example. If we are a part of the systems and we ourselves do not trust the system that we are a part of, who will? Who will trust our system? And also policymakers. I'm not talking about politicians. I mean, I'm talking about we as a medical epidemiologist who promote vaccination and medical officers of health or other regional technical director who we promote vaccination is the way to go. And if all of you and all of us in this organizations still do not trust in our recommendation, that is also of concern, and we need to work on that. Complacency is another factor, another C. Whether or not the person considers the disease itself to be a serious risk to their health. So if you go to walk to and fro your home and you see people on the road, you see a lot of cars on the road, you see people on the market, pardon my cat. And you may think that COVID is okay. People are going about their business and so on. No, that's not so. And I just show you the figure, what's happening in the hospitals, right? So at one point we may think that no, I'm okay, I'm healthy, I won't be catching COVID-19, and I'm not going to be ended in the ICU. And in that case, you may want to consider and think again. And this is the frequency of comorbidities, confirmed COVID cases, and also deaths. So confirmed cases, what we found is most persons have cardiovascular diseases and have been a COVID infection, diabetes, asthma, kidney disease, and obesity. So as we talk about cardiovascular disease, hypertension, and diabetes, and obesity, very prevalent, and we can see it for ourselves. Some of us are hypertensive, diabetic, and you are likely to be infected. So you are susceptible to be infected with COVID-19. So when we look at the COVID deaths, what are the comorbidities identified from the COVID deaths? Age 60 years and over, being old is one of the risk factors for dying from COVID-19. And one more time, cardiovascular disease, hypertension, or diabetes, and other, asthma, obesity, and so on. So we know for ourselves, if we have one of those, and we are very much susceptible to these diseases. And based on what's happening in this third wave, positivity, and at this point in time, we consider everyone in this country is positive. Now, calculation, there's another C, the individual's engagement in the extensive information searching to weigh up the costs and benefits. So that's for the individual level. We have WhatsApp groups, we have internet, we have Facebook, we have other means of getting to information to our gadgets and hearing from the news and so on. But some of us tend to listen to the negative vibes, and that's not good. And when you try to calculate the costs and benefits, what are the costs that you have to pay if you catch COVID-19, since you have hypertension and diabetes, and data showing very clearly. So you have to weigh costs and benefits. And constraints, this is easily be taken away. This is to show you the access to the vaccine. So government of Jamaica has tried so hard to get vaccine accessible. So we have a vaccine centers, sites, bliss sites, even though we do bliss at some point to make sure that persons are fully vaccinated. And those are published regularly in our Facebook page and WhatsApp groups. So access is not going to be an issue. And this is very important thing. And I like this one very much. Collective responsibility, the willingness to protect others from infection through one's own vaccination. So it's not only me, it's not only you, it is not only individual choice. If we have chosen not to take vaccine, and if we become infected, we end up with the infection and severely ill, and we may end up infecting others. So your decision is not only impacting you, your neighbor, your relatives, your mother, your father, your community, and by and large, your nation. So this is what we call we call it personal responsibilities, but what we also forgot to mention is collective responsibilities. So 5 persons in the family, in my family, all of us took vaccine, and all of us should be protected from being ended up in the serious illness of the COVID-19 and also following the infection prevention and control procedure. So we should be okay. So collective responsibility, those 5 that I would like to mention and think of why we should be taking the infection control practices and also the vaccine at this point in time. So in summary, we are entering the 3rd wave and we have not even reached to the peak as yet. We are looking at, if you remember the independence, immense independence, that weekend, we have many parties and some gathering took place. And 2 weeks from there, we are anticipating more cases are going to come down, and we started to see more cases are coming down in the week. So we are looking at another 7 weeks, we will see more cases are going to be identified. And make sure that you are not one of the statistics. And non-pharmaceutical interventions are tested and proven to be effective if properly practiced. I don't have to go into detail again. And vaccine prevents serious illness. Vaccine prevents serious illness. What we see is persons who have not vaccinated against COVID-19 ended up in the serious illness and even in ICU, intensive care unit, and some of them die. Increase and rapid coverage of vaccine in the population is very important. That's why we're trying to mobilize as much as we can. We try to vaccinate as much as we can, because if we continue to maintain one virus, one strain in one particular location for such a long time, the virus mutate. So now we have Delta, very transmissible virus that identified so far globally. And even though we have not yet identified laboratorily in country, we assume that Delta virus is here already because we are seeing explosive number of positive cases. So if we are not able to vaccinate most population to reach the herd immunity, we are going to end up having another virus, another variant, which may be more explosive than Delta. And in that case, I don't even want to imagine what's going to happen. And our health facilities and hospitals are already overwhelmed, and healthcare workers are very frustrated, very tired, and even some of us have infected and has to stay home. So if we have more persons are being infected, quarantine, and isolate, who is going to look after you if you become one of the patients, either COVID or non-COVID? And that's the end of my presentation. Thank you so much for listening, everyone. Over.
Hello, I'd like to ask a question.
Madam Moderator or Chairman.
Hello, Dr. Ong. Can I ask you a question?
Yes, you can. I'm just saying to the Madam Chair. I don't know if.
Yeah. So my question is this, right? We know that the COVID shot.
1 second. Can you identify yourself for me, please? I'm not sure who is asking questions.
Okay. My name is Lorraine, and I am a registered nurse in Canada. So we know that the COVID shot was never proven FDA safe. Okay. It's not like the regular vaccines.
Can you say that again? COVID vaccine is now never proven what?
It's not proven FDA safe by the Food Drug Administration safe. They have been trying to get a safe coronavirus vaccine for over 20 years, and it was not proven safe. We're just using it now because we're in a crisis. We're in a pandemic. We must not lose sight of that. This immunization, it's not even an immunization, right? It is an operating system. It is different from the other immunizations that we've had in the past, right? There are risks with these. So when we're talking and we're pushing this COVID injection, we shouldn't lose sight of that. We can't say, okay, we are in a crisis because the healthcare workers are not even on board with the very system that we're in. We have to be honest with this, right? The coronavirus injection is not FDA safe, right? Why should people want to willingly go give up their arms, give up their future, where we don't know what the future is going to be, because The shot is just not proven safe as yet. Why are we pushing and censoring our nurses to take it? I mean,
Thank you. Are you saying your experience in Canada, censoring? I'm not sure if we are doing it here in Jamaica. Are you talking about your experience in Canada?
well, I see it in the news there. They're censoring the teachers out there. They're saying those who have not taken the COVID shot is gonna like lose their job or got less numeration, and those that take the shot
That's a
are
fake news, man. Fake news. I don't know if you have spoken to any nurse or any
well, yes,
teacher
no.
in Jamaica.
My best friend, because I did nursing at UHWI. My best friend is a school nurse, right? And she is in a panic right now. The last thing she told me is, Lorraine, they said that if
I
I don't take
appreciate
the
your
shot,
answer. Can you make a point so that we can accommodate others? What is your point, please?
my point is, I know you're an epidemiologist and you're just looking at the numbers. You cannot afford to just look at the numbers, right? You have to look at everything around, behind, and surrounding it, right? And you have to be honest with people and acknowledge, because whether you say it or not, we know that the COVID injection is not proven FDA safe. We know that. And it is not like the other regular immunizations of the past. It's a much different system.
Okay, thank you so much. You finished? Thank you so much for
Well,
yeah, thank you so much for your contribution. And I know you are working in the first world country. So I would anticipate that you have more knowledgeable, and being as a nurse for yourself, you're going to be weighing costs and benefits when it comes to pandemic. So when we look at as a individual, not necessarily by our emotion, I'm trying to look at the numbers, even the epidemiologists you mentioned about being honest. I don't think I have lying anything on my presentation, trying to make up data or trying to make up the numbers and so on. And also, we are not pushing. We never use push. You are talking about persons who are going to be losing their jobs. And I think you will need to speak to persons on the ground as to whether or not they have lost their jobs. We have never, government has said something like that in the past, but we have never implemented, and there's no the mandatory and so on. That's the word that we are using. People are using. We will never go to that based on our position. But when we look at the safety and effectiveness of the vaccine part, we are, as a scientific community, closely following and directing from the World Health Organization, which is a reputable global health organization, and also Pan American Health Organization. So those vaccine which are being proved for emergency use, and in some countries for full use by the World Health Organization. So we are just following the World Health Organization recommendation when it comes to safety and effectiveness. So as part of the health system, we will never put our people in jeopardy when it comes to health. We cannot afford that. I mean, not like Canada. Also,
well, you know what? Just one more point. We cannot afford to just listen to what World Health Organization says. We need to look at the research. We need to look at the research that was done on the COVID vaccines and see what happened to the animals that were tested on it. It's over 20 years they've been trying to get an immunization for coronavirus, and it was never proven safe. We have to go beyond what WHO says and look at the research for ourselves.
Nurse, as a doctor, I won't go beyond the WHO recommendation. The WHO recommendation is being accepted by the countries around the world. And there are some countries that they may have their own the take on the WHO. But WHO has been proven the leader in all the outbreaks that's happened in the past, current. So we are, as a health, one of the organizations that we follow is World Health Organization. It's not the one of the organization. The WHO recommendations being a tier 2, and also I mentioned about Pan American Health Organization. So what we have now is the data that I showed you previously. We have hospitals overrun by patients with COVID-19 and non-COVID-19 patients. So we have now two areas that we're looking at. One is persons coming in with COVID-19 and persons coming in with chronic non-communicable diseases. So once systems are overwhelmed, the systems are going to be, once systems are overwhelmed, that's going to impact the whole health service delivery in the country. But what we look at
Doctor,
the serious
I have,
illness, I'm not here to debate, ma'am. So I'm just giving
Doctor,
you the,
I
what we
have one very poignant point. People who have had the COVID infection like me and my whole family got the European strain, right? Why is it that we still have to get the shot? I know what immunology is about. I mean, it is basic science, right? You get infected with the antigen and you develop antibodies to it. Why is it that we're talking about how many people in the world have gotten the COVID injection, but we're not looking at those that have already gotten the immunization status through natural means?
natural means. All right, Nas, I am not here to debate with you, and I think that's for another time. We can do that, but for the time being, Ministry of Health and Wellness position of Jamaica position is we follow the WHO guideline, we follow the WHO instruction, and we follow the WHO recommendation as to which vaccines are safe. And based on the evidence that we have locally and also internationally, and even the United States, I'm not sure about Canada, and we use this experience and we use these challenges and we recommend, not push, we recommend the population to be vaccinated against COVID-19 for what we have, even though we don't have all the luxury of getting the various vaccines that Canada and the US may have. But we have what we have, and we offer to the population, and we provide the data that we have locally as well as internationally. All right. Any other questions from any other persons, officers?
Hi, Dr. Ong. Good evening.
Yes, Mrs. Peter, go ahead.
Right. So I hear the passion of Huawei P30, and she has her international experience and she's very strong about her point. However, in life, we have different sides to different stories. This evening, I am challenging us who really have an interest to see us going back to normal, because we recognize that while the points are very strong about the COVID-19 vaccine, you would have just presented some very critical information that is affecting not only us as an individual, but our entire nation. We see the data in the West. We see what is happening in our hospitals. We do not have the resources like a Canada or like America. And so tonight, what we want is to challenge those who believe in the process, to really not to be daunted by the strong pointers that are out there against the COVID-19 vaccine. So we're saying to individuals, if you believe that the vaccine can make a difference, do not be afraid, just as all persons may have their concerns, which we respect and acknowledge. We also have our very strong concern about the history of vaccination, and that is our civic responsibility to get vaccinated if you want to believe in it, and that is to really follow the guidelines as set out by the Ministry of Health. So we want COVID-19 advocates. We want individuals who within their circles can encourage their family, their friends, just to take the vaccine and also to adhere to the COVID-19 protocols. So this evening, we have approximately 9 of us on the platform. if each of us can take the time out to transmit the correct information about the vaccine, learn about it, transmit the correct information, and mobilize individuals to, one, not to be daunted, but to get the facts and take the vaccine, that can make a difference. So we want strong advocates who believe in the COVID-19 vaccine to encourage others to take the vaccine. There are a lot of information on the social media, just like history would have taught us to, with other vaccines and with other drugs. There were also opposition, but today we are able to benefit from a strong vaccination program that we would have, as Jamaican, we would have embraced, and we would have done everything in our power to ensure that we have a safe vaccination system. So log on to the program. We need ambassadors. We need young people who fully understand the dynamics of the COVID-19 vaccine to help to transmit the correct information. Thanks much. Over to you.
Thank you so much, Mrs. Witter. Yeah, sorry, Mrs. Gay. I thought you were going to be moderating. Yes, Mrs. Gay.
Yes, sorry about that. I actually had some technical difficulties and I was bumped off the meeting for a little bit of the conversation. Thank you very much, Mrs. Vito, for that. We're very well said. And we do appreciate the information that has been given to us. We are now more equipped with more knowledge that we can make more or better informed decisions. Thank you very much, Dr. Ong, for sharing with us. Not sure how much of the conversation I've missed, but I'm not sure if anyone else had any other queries, or we were all wrapped up before I came back on as it relates to queries.
All right, I think Adam may not have any question, but just want to emphasize the point that even though we talk about vaccine is part of the prevention strategies that we use alongside with infection prevention and control practices. And based on the experience and based on the data that we know from the other quarters and other countries, when they thought that they have vaccinated their population and they have reached to the particular point and they feel as if they don't need to practice infection prevention and control. At that point, Delta variant came in, and most populations are now infected. So it's just not only vaccine is the answer. Vaccine is not the only answer. We have infection prevention and control practices has to go along with vaccination, even though you are fully vaccinated. So that's the way to go.
Indeed. And we had most of the regional office staff were on the live feed, but they had to drop off at 7:10 because the office was closing. So they have dropped off. But what we will do is to ensure that the recording of this meeting goes out to everyone, so persons would be able to benefit from the information that was shared here this evening. So we are a bit over the time, but it is very necessary to hear this information that has been given to us. Thank you very much again, Dr. Ong, for coming on and
All right,
sharing.
good night. I just wanted to make the point again, if I may.
I'm sorry?
Thank you so very much again, Dr. Ong, for your presentation, and you always give us a lot of information, and we really appreciate your work. I hear the concerns about the persons who do not support the vaccine, and there are those who want to wait. I even heard on the news today, the NAJ president talking about some nurses who have not taken the vaccine. We recognize that not everybody will be on board initially. And I always go back and think how it is that the public health practitioners back in the day when polio was introduced, back in the day when MMR was introduced, when smallpox, all of those immunizable diseases that now we don't even know what they look like because they have been eradicated. Dr. Ong would have pointed out in the initial part of his presentation that the last time we had these cases were many years ago. And so a lot of people don't know the complications of these diseases because we've had a successful vaccine program. And I know those persons would have faced a lot of resistance in the early days. There would be a lot of the same vaccine hesitancy, the same pushback and whatever, but they persevered and they did what they needed to do. And today we reap the benefits. And here we are. I think though our population is much more intelligent than then, we have a lot more access to information. Social media has blown things up for good and for bad. And so here we are in the fight again. But I believe that, I mean, if it is that after so many years, our scientists have not developed the capacity to do things better and faster, then it would be an indictment on us as public health. If today we can, I mean, easily go to the moon and back, and we have not developed new technology in terms of vaccine, yes, it is new, and it is going to be new. And are we saying that we should just remain back in space age or in the stone age and not move forward with technology and try new things for the betterment of our people? People are really dying. And yes, you have the choice of being, yeah, so what? All of us come get infected with COVID and develop our own immunity, natural immunity. But it has been proven that this natural immunity is not going to last forever. It isn't going to last for a very long time. And that is why we still have to push vaccination. And even with vaccination, we still have to push the other protocols. But we're all in this fight together. Let us just see if we can do the best that we can so that the vulnerable, protecting the vulnerable. And we're protecting the vulnerable by ensuring that we who can be vaccinated, do get the vaccine. Those who can, I mean, everybody maintains the protocol, and together we will all be safe. 20 years, I would like my children to be able to stand proudly and say, they did a good job. They did a good job. And I think they will be able to do that. So we push up. Thank you.
Thank you, Dr. Campbell. And Mrs. Sweeto underscored the fact that the COVID-19 vaccines underwent preclinical testing in animals and clinical trials in tens of thousands of people, which established their safety and efficacy. So we are pushing forward. We as individuals, we have a work to do to keep not only ourselves safe, but our communities, our families, our children, our elderlies, and we have to do so responsibly. So get informed and make sound decisions, informed, knowledgeable decisions, and check the facts because it is out there. Then after you've done so, we must do what we have to do. So it is now 7:31. I would like to thank everyone for joining. It was a very informative session. We really learned a lot this evening. And as I was saying earlier, that we should be now better equipped, with information that we can go out and make better decisions and inform others to stay safe. Remember, it's not just the vaccines, it's also the infection control protocols that we must abide by. Thank you very much, Dr. Ong. Thank you for the presentation.
You're welcome.
Truly appreciate it. Thank you everyone for joining this evening's program. The rebroadcast will be sent out tomorrow. so that you'll be able to share it with your other staff, share it with family members, share it with everyone. And let us do all that we have to do. Have a good evening, everyone. Have a good night. Stay safe and God bless.
Okay, good night.
Good night, everyone.
Good night, everyone. Thank
Okay,
you.
bye-bye.
Thanks, Doctor. Blessing. Bye, Doc.
You're welcome.
And
Bye-bye.
everybody.
Dr. Ong,
Yes, yes.
when I got kicked off, the system automatically switched you to the host. So would you kindly just end meeting for all? Select that option to end meeting for all for me, please.
Okay, let's do that. And meetings.
Thank
Okay.